Hello, my name is Sharon Monette Owens, and I'm doing a report on ultrasound for the identification, management, and treatment of femoral artery pseudoaneurysm following percutaneous access procedures. My report covers an overview of femoral artery pseudoaneurysm and ultrasound exam methods, procedures, and protocols and approaches for diagnosing, managing, and treating pseudoaneurysms, as well as a case study example demonstrating the effectiveness of ultrasound for diagnosing, managing, and treating pseudoaneurysms. A pseudoaneurysm is a contained, pulsating hematoma with a communicating neck that arises from an adjacent artery. In the case of a femoral artery pseudoaneurysm, it typically follows a catheter procedure where a surgeon may have had to use a larger diameter sheath, or the patient is on anticoagulant medication. In these cases, it typically happens 1 to 10% of the time with following a catheter procedure such as T-bar. So I put together this little illustration, a close-up of this on my presentation board, but basically the catheter is inserted and removed through, and it punctures the artery, and following removal, a pseudoaneurysm may form through the puncture site, and the neck portion of the pseudo tracks through the needle where the needle tracked through from the catheter, and then it feeds the lumen portion of the pseudoaneurysm in which resides in the interstitial tissue area. So here's the 3 layers of the arterial wall and the lumen of the artery, and the other 3 layers. And so blood flow is coming through the artery, traveling into the pseudoaneurysm through the neck into the lumen, and then it swirls around and comes back into the artery and falls out. And so therefore you'll have, when you're looking with a transducer, you'll typically see a yin-yang pattern of blood flow, so that the red, where the ultrasound beam is coming in and the blood is coming towards the ultrasound beam, it's red, and where it's going away, it's blue. So that's a telltale sign of a pseudoaneurysm. The neck portion will typically display a to and fro blood flow pattern. And here's a demonstration up here that shows the yin-yang symbol in the lumen portion of the pseudoaneurysm, as well as a to and fro blood flow spectral waveform. And you can see the spectral Doppler is in the neck portion. Well, it's kind of hard to see, but it's in the neck portion of the pseudoaneurysm. So that would display this type of a waveform pattern. Groin duplex ultrasound is the gold standard for identifying, managing, and treating pseudoaneurysms. And this is because it's simple, affordable, non-invasive, and has real-time imaging. Typically, you want to use a 5 to 10 megahertz transducer with high resolution, and you want to do a B-mode sweep, looking for a mass and looking for echogenic debris and thrombus. And then you also want to use your color and your spectral Doppler to look for the yin-yang sign that we mentioned earlier, and the to and fro flow in the neck. Once you've identified a pseudoaneurysm, you want to measure the maximum dimensions and evaluate the flow in the adjacent artery with color and spectral to see if that's normal. In addition, you want to evaluate the parallel veins to see if there's any thrombus, and that you can do in B mode with compressions, and also evaluate the vein with color and spectral for flow to rule out arterial venous fistulas. For the management of pseudoaneurysms, ultrasound is used to monitor for spontaneous thrombosis and or to see if the pseudoaneurysm is growing. Following a procedure like a catheter procedure, ultrasound can also be used to treat a pseudoaneurysm that is found by using the ultrasound probe as a compression. And in this case, you want to push with the probe on the neck of the pseudoaneurysm. This method has been around for a while and typically can be successful in 75% of the cases, as long as the patient isn't on anticoagulants or the pseudoaneurysm isn't too big. In cases where the ultrasound guided compression of the pseudoneck is unsuccessful, the treatment of choice is ultrasound guided thrombin injection. And in this procedure, you want to first identify the pseudoaneurysm using spectral and color Doppler to find the blood flow patterns. And then once it's been identified, you want to turn off the color and spectral and visualize the pseudoaneurysm using B mode so that you can see the needle and be able to guide the needle into the lumen where it is injected with the thrombin. And it's also important in this case, you can see here in the picture, to avoid the neck portion, because if you were to inject thrombin into the neck, it could propagate into the adjacent artery and thrombose the artery. So you want to avoid that. And then once the thrombin is injected, you can turn the color flow back on to check and see if blood flow cessation has occurred, and then also evaluate in B mode again for evidence of thrombus. If this procedure doesn't work, the thrombin injection procedure, a patient may need to have a surgical treatment of the pseudoaneurysm. The case study I chose was an 86-year-old female with severe aortic stenosis. She was high risk for surgical aortic valve replacement because she had fatigue, shortness of breath, hypertension, hyperlipidemia, chronic systolic heart failure, atrial fibrillation with impalpable cardioverter defibrillator, and colon cancer, status post partial colectomy. Therefore, she needed to be treated with a left heart catheterization and a TVAR, which is a transcatheter aortic valve replacement procedure. So on completion of this procedure, the surgeon noted a hematoma at the site of the catheter insertion and ordered a groin Doppler ultrasound exam, which took place 3 hours status post. In this exam, we found a 1.5 centimeter by almost 2 centimeter pseudoaneurysm, and this is the picture of this. This is the adjacent artery, and then basically they decided to keep an eye on it. So they ordered an ultrasound exam for the following day, and in that exam, we noted a multilocular pseudoaneurysm, which means there were 2 lobes. In this case, it's hard to see, but because I don't have the color image here, but this is 1 lobe and this is another lobe, and then the neck is somewhere in here in this picture. But in this case, the overall measurement was closer to 3 by almost 2 centimeters. The patient was released from the hospital and ordered for a 2-week follow-up with one of our vascular surgeons and another groin Doppler ultrasound. And when she came back for that procedure, we also noted a multilobular pseudoaneurysm, which is right here in this picture. You can see these. This is a smaller one and a larger one, and then the neck is here, and here is the adjacent artery, the femoral artery. And we measured the largest lobe in that to be 2.5 by 2 centimeters. So that lobe was much bigger than the lobe, one of these 2 lobes here. So in that case, we decided to treat it, and the vascular, we use ultrasound guided thrombin injection, and the vascular surgeon injected the lumen portion of in the larger lobe of the pseudo, and we did that with B mode as explained earlier. And in this picture, you can barely see it because it's far away with this video, but there's the needle right there. And so we injected it and then followed that with color Doppler. And you can see that there's a little bit of color here and here, but none in the lumen. So, and then if you could see a little closer, you can kind of see here, there, you can also notice some thrombus in there. So it had immediate cessation and it was successful. So that shows the successfulness of ultrasound as a gold standard method for identifying, managing, and treating pseudoaneurysm. I hope you enjoyed my presentation and I look forward to your questions.